Look at that. Isn't that a great layout? You son of a gun.
This campaign is no good.
No good!
Darren and Larry, the original Mad Men on Bewitched.
Hi, I'm John Malos, and welcome to Connect with Me, live on the showroom floor here at Ventura TV. On this day, it's Ask an Expert. That's right. You're going to call in 265-4331. Why? Because we have an orthodontist in the house. If you have problems with your teeth, your jaw bones, anything to do with your mouth, hey, call in, ask your question. We're back in a moment.
Tonight I want to discuss the importance of the television medium to the American people.
I see we already have a phone call here on Connect with Me, but if you're patient, we can't take the call right during the monologue. You'll have to wait until we introduce our guest and you kind of get the drift of what we're talking about today. And you know, if you have an orthodontist in the house, there's one thing he cannot help you with. If you talk a lot, he cannot help you with that. So therefore, there's no help for me. There's no help for our staff here because they all talk. I think they talk more than I do, and I'm the host. And everybody thinks I talk too much. Okay, I'll be quiet. No, I better not because we're live. Anyway, we're talking about many different things today that has to do with orthodontics, being an orthodontist. How many of you have kids who have braces or need braces? I bet the majority of you, or a lot of you. Let's go to the videotape and I'll show you exactly what I'm talking about. If you do, no doubt you are seeing an orthodontist right now. That's a specialty. If you're an orthodontist or you want to be, you've got 4 years of dentistry school, 3 to 4 years of orthodontics training. That means putting on braces. It means that your teeth might be crooked at this point. And what does that mean? Well, it means improper bites, overbite, underbite, crossbite, missing permanent teeth, skeletal discrepancies. No use of headgears at this point, though. Your orthodontist may also see the need to move teeth or to direct jaw growth as much as possible while kids are growing up. Braces are usually metal wires that are inserted into the orthodontic brackets. Now, the brackets are usually made of stainless steel at this point, metal, or a more aesthetic ceramic material. The wires interact with the brackets to move teeth into the desired or correct position, if you will. This treatment can help straighten out your teeth, your smile, your jaws, your entire mouth, but as I said, it can't help you with the talking. And it will put them back in the correct position. Live in our studio right now, ladies and gentlemen, is the one and only Dr. John Bayrakdarian. He is the owner of Unique Orthodontics here in Fresno and another office in Clovis. 2 locations right here in the Central Valley. He's been in Fresno for the better part of 10 years. He grew up in Lebanon. He went to dentistry school. He went 3 to 4 years for training to be an orthodontist. It is a very difficult thing to do. I know I could not do it. If you have a child who may need braces or you see something is amiss inside the mouth with the teeth or the jawbone or anything else, call in. This is Ask an Expert Day right here on Connect with Me. Your phone number, 265-4331. We are back with the doctor in the house in just a moment.
Frigidaire. We introduced the first home freezer, the first pulsator agitator washer, and now we introduce the Frigidaire Orbit Clean Dishwasher, designed with a unique wash arm that gives you 4 times more water coverage for a consistently better clean. Frigidaire, over 90 years of legendary innovation.
See the full line of Frigidaire appliances at Ventura TV Electronics and Appliances.
So, you think I talk too much? Well, I'm going to let the doctor do all the talking today, and it's time to welcome in Dr. John Bayrakdarian. Did I get that right?
Yes, you got it right.
All right.
Bayrakdarian.
Bayrakdarian.
Okay, yes.
Okay, there it is. All right. We already have a phone. Well, we did have a phone call, 265-4331. Explain in further detail a little bit, because my monologue obviously explained it, but in detail, if you're an orthodontist, your specialty is to try to correct a jawbone, teeth that are amiss. Is that correct?
That is correct. It's very important to correct or to have an orthodontic consultation as early as age 7.
Oh, that young.
Yes, it doesn't mean that we have to put braces on or put appliances on. Have the kids checked and see how.
Even while the
growth is.
jawbone is still growing, huh? and
That's
everything.
right. Even though
Okay.
if we still have baby teeth, in certain cases, rarely though, but in certain cases, we can start treatment to avoid in the future having any type of extractions of permanent teeth or even surgery. So we just take an X-ray, a panoramic X-ray, and then check the bite and check the teeth. If there are any missing permanent teeth, that we can redirect the growth with certain appliances, which is very important.
Yeah, you want to try to get it early
Definitely.
before major problems occur.
Exactly,
Yeah.
yes.
Okay. Let's take a call here, doctor. Good morning. You're on Connect with Me. How are you? Hello. You're on. At least I thought you were on. Are you on? Okay. We'll kill the mic there. And anyway, so you were born in Lebanon, but you were trained here. You went to school here. You were
Yes.
you were originally landed in the East Coast and
That's
got
right.
your training and schooling over there. Talk
Yes.
about that a
So,
little
yes,
bit.
I did finish my dental training at the University of Pennsylvania in Philadelphia, 4 years, and afterwards 4 years of orthodontic residencies, different cities, Nashville, Tennessee, which I did my orthodontic fellowship, and 2 years in Rochester, New York. And
Right.
afterwards, Fresno was the destination to come and start my practice.
Yeah, these are all the places you've been. New York, Philadelphia, Rochester, New York, Nashville. You are also now part of the American Association of Orthodontics. Now, what does that mean?
It means that to be a member for the American Association of Orthodontists, first we have to have a training completed by a certified orthodontic residency program, which one of them is University of Rochester in New York, which I attended. And
Right.
by that, we as orthodontists can do the treatment and can, just like any other specialty of in the medical field, first we have to go into dental school and then get the specialty, which is one of them is
Yeah,
orthodontics.
it takes years of schooling and training to do
It
this
is.
type of work. And,
It is, yes.
you know, very, very proud of you that what you've done. Open up 2 businesses, not one, but 2 different locations. One in
Yes.
Fresno is located at what, 1616 West
West
Shaw.
Shaw.
The other
Yes.
one is in Clovis. Where is that?
Right in downtown Clovis, which
Okay.
On Clovis Avenue between 4th and 5th Avenues. And the good thing about having 2 locations is the convenience for the patients.
Yeah.
Yes,
Yeah,
and,
that's right. All right, another phone call here, doctor. Good morning. You're on Connect with Me. How are you?
Good morning, John. Good.
Good.
To Dr. John, I'll call him.
Yes.
I'm up
Bayrakdarian.
in my years. we got a double header today. Listen, I'm up in years, 60s. Is whitening your teeth can be a problem with either too much whitening or does it affect your teeth, in other words? And I think that was about the only question I had right now.
Yes. As far as whitening teeth, that's something that we don't do it in our practice. We do only orthodontics. But I can answer briefly, say that too much of whitening of teeth, which is
Is it safe?
It is well. It has to be consulted by your general dentist to see if you are candidate for that or not. In certain cases, if you do have fillings or restorations that and whitening the teeth, the material in it, there's hydrogen peroxide in it. It might cause some sensitivity. So whitening it too much, again, it is.
Got to be careful. Yeah.
Yes, very careful. So
All right.
consult with your dentist on that.
Let's
Yes.
turn to the monitor here, doctor, and we'll take a look at your lobby. This is over at West Shaw, 1616 West Shaw. Go
Correct.
ahead and move up there just
Yes.
a little bit and talk. And this is the lobby area. A lot of people. Your
That's
place
right.
was packed the other day.
Yes.
I noticed that. This is when you walk into the reception area there. And we actually have another piece of videotape of you actually working on a patient. So what kind of problems do you see with some of your patients? We can go ahead and roll that other videotape with the doctor. They're working on one of the patients. There's an x-ray right there. What are we looking
Yes.
at there?
What we're looking at is an X-ray of of the teeth to see, for example, if there's enough room or enough space to have teeth erupted in their correct position. For example, the canine which I showed on the x-ray, there wasn't enough room for that. So with braces we can create space for that and bring the teeth down into its correct positioning.
Right, and there you are working on one of the patients here, and what
Yes.
was his situation?
In his situation, it's a regular checkup on routine checkup, which we do see patients once every 4 to 6 weeks, and change the colors, change the wires, and as necessary, we decide the treatment each and every visit.
Now, he looks like a young patient there,
Yes.
and many of your patients, would you say the majority of them are young patients?
I would say nowadays I would say 60% of my patients are adult patients. Sorry, 40% adult patients and 60% I would say they're teenagers or between the ages of 10 and 13.
We do have a phone call. Good morning. You're on with the doctor. How are you this morning? Hello? Okay. Anyway, so about 60% of your patients are the younger patients. What kind of problems are you seeing? Are you seeing overbites, underbites, problems with their jaws, or what?
Yeah, different issues we have. Mainly crowding. When I say crowding, there would be sometimes they do have the impressions, patients or parents, that they're too much of teeth they have, since they do see crowding. In true reality, there's a discrepancy between the size of the teeth and the size of the jaw, so that's why sometimes we do have crowding, sometimes we do have spacing. And those issues could be resolved by definitely with braces, or in certain cases, very mild cases, would be Invisalign, which are those clear retainers that correct teeth as well.
Okay.
Yes.
All right, we are going to be back here. Time to take a commercial break on Connect with Me. Your phone calls are important. Today is Ask an Expert Day. If you have anybody in your family, like nieces or nephews or sons and daughters, that perhaps need a correction, a problem with their mouth, their teeth, you can call in, ask Dr. John Bayrakdarian a question. He has 2 offices here. It's called Unique Orthodontics, one in Fresno, one in Clovis. 265-4331 is our number. We're back in just a moment.
From now on, when I sneeze, I'll try to sneeze more friendly.
And we're back. We're talking with Dr. John Bayrakdarian. He is an orthodontist, and he has 2 offices right here in the city of Fresno, and one in Clovis. Okay, so one in Clovis, one in Fresno. He's been in business for 10 years. He went to dentistry school. He's got a lot of schooling, a lot of training, has a lot of patients, a lot of people with problems out there. So our phone number, 265-4331. All right, you can see, doctor, by looking at me, you know, the way I talk and the way I carry myself, I do have an overbite. See that?
Yes.
It's an overbite. Can you correct that at my age?
well, here's a little bit of clarification of an overbite.
Okay.
In certain cases that patients, they do say that we have an overbite, but in true reality,
Well, is mine an overbite? I mean, see that? The top overlaps the bottom.
That's the way it should be. The top should overlap the bottom.
Just like this?
Exactly.
Okay. All right.
But there should be a little bit of a distance between the top teeth and the bottom ones.
Do you see a problem with my...
I do. Well, you know, from far behind, I do see that you do have some crowding that could be corrected with braces, but you don't have an overbite. That is really an issue besides the crowding.
Right, okay.
And
so at my age, I can go in and get braces, right?
As long as we do have teeth and we do have enough bone or periodontal apparatus to support it, yes, we can put teeth. There's I have patients between the ages of 7 and 72 years old. So there's no age limit. There's no age limit.
Yeah,
yes.
Yeah. Whether it's no such thing as being too young or too old. Then,
exactly.
Huh?
Yes.
All right. We're talking with the doctor here. I see we have another phone call. And I see caller ID here Amy is calling in. It seems like you've called in like 2 or 3 times, and each time I press the button, you don't say anything. So let me press it one more time. If you hear me talk, just say hello, and you're on the air. Let's try it one more time. Good morning. You're on Connect with me. Amy, how are you? Hi.
Good morning. Good morning. I have 2 questions. And one of them pertains to the Invisalign versus the typical or the conventional style braces. On the Invisalign, I understand it's a series of snap-in type molded plastic retainers. Could you talk about cost comparison? If I'm older, don't want to have the brackets and the wires, want to go with the Invisalign, how's it going to price out? I know how the typical or conventional type brace, but interested in the Invisalign. Can you talk about it a little bit?
Sure. As you said, the Invisalign, these are a set of retainers, clear retainers that are set by the computer that we have to take impressions and send to the lab to get different sets of retainers. And basically the retainers on a sequence, they do correct the teeth and crowding or spacing to a certain limit. When I say to a certain limit is, in my opinion, not each and every patient is a candidate for Invisalign.
Why not? Why?
There are certain types of crowding, the severe crowding that, myself, I don't recommend it. I do recommend traditional braces. For example, extraction cases that,
What's the difference in price, let's say?
It's pretty much the same.
Which is
in my
usually,
practice,
generally speaking. Not have to give an exact figure, but is it a couple of thousand, 5,000?
Close to 5,000.
Close to 5,000. Okay.
Plus or minus,
Do
it depends.
most insurance companies, do they cover?
They do cover. They do cover to a certain limit. It's for insurance companies. There's no difference as far as whether or not it is Invisalign or traditional braces.
Okay.
Let's say if you do have a coverage of $1,000 or $2,000, it doesn't matter if it's Invisalign or traditional braces. So the best thing to find out is to get an examination and see if you're candidate for Invisalign or not.
Yeah, outstanding.
Yes,
Come over and just just sit in the seat and you can examine, right?
Examine. We'll take a complimentary panoramic X-ray as you saw on the TV.
So it's like a consultation.
Consultation,
basically.
correct?
All right.
Yes.
All right. Good morning, Henry. You're on Connect with me. How are you? Hello.
I'm good. I have a question for the doctor.
Yes. Yeah. Go ahead. Speak up.
I was wondering when it comes to the back tooth when I had the dentist take out my wisdom teeth, and it still hurts in that area. What do I do?
Well, that's a question of your if you had your wisdom teeth extracted and you still have pain there. How long you had the extractions done or completed?
I've had the wisdom teeth pulled out a few years back. All of a sudden, I'm starting to have pain right in the back.
Yes. Well, that's something that the oral surgeon or the dentist that did the extractions or pulled the teeth, you can go and consult with them, and they can take an X-ray and see if anything going on there. It might be not the wisdom teeth; it might be neighboring teeth that you would have, or you have some cavities or something going on there. So it's better to have it checked by your dentist or the oral surgeon.
Yeah.
Okay.
All right. Thank you very much for your call. We really appreciate you watching the show. So yours is a specialty, and orthodontics is a specialty. It's a part of dentistry, but you're not a general practitioner of dentistry. Is that? Did I say that correctly?
You said correctly. Yes.
Okay.
But prior being an orthodontist, as we mentioned earlier, that you have to go to a dental school
Right.
And
well, everyone does it. They want to get into the field, right?
Correct, yes.
Okay.
And to be a dentist and you have to work on patients, that's why I'm able to answer their questions, even though they're not related to orthodontics, but, I'm able to answer their questions.
So in the dentistry industry, there is a general practitioner, there's an orthodontics side of it, and there is, if you're a surgeon, that's another area.
Yes, there's oral surgery, there's periodontics that they deal with gums, and you do have pediatric dentistry.
Okay.
You have prosthodontics that they deal with the dentures and implants and so forth. Even general dentists, they can do implants, or oral surgeons or periodontists.
Right.
One thing that I don't use in my practice is, which I think all my patients like, is I don't use needles. I haven't used it for a long period of time. I don't need to use needles.
You don't need, and there is no pain. I was going to ask you that. Well, let's take a break and we'll come back and ask you about, why you don't use the needles, why there is no numbing of the gums or the jaw or whatever, and you put those braces on one way or the other. Your phone calls are important. 265-4331. We're here with the doctor. If you have any questions or have any family members that need braces or are having problems with crooked teeth and overbite and underbite, call in and ask the question. This is your last chance. It's our last block coming up after the break in just a moment.
Ventura TV Appliance Center. We're the low-price leading brands reliable advice place. The Whirlpool Dream Kitchen Get Yours Today place. Check this out. Right now, get huge savings on select Whirlpool appliances and pay no interest when paid in full within 6 months. At the hometown low price, think outside the big box place. Since 1951, Ventura TV Appliance Center. We're working hard to be your place.
And we're back. We are talking to Dr. John Bayrakdarian, and you're an orthodontist. And let's roll some videotape and talk about why don't you use needles?
Well, in orthodontics, in order to put braces on, we don't need to numb the patient or make them.
There's no pain.
No pain initially putting the braces on, as you see there. Putting the brackets on.
Those are traditional braces, right?
Traditional braces, yes.
Right.
Putting the glue there and then curing it with the light, and the wires initially would be very thin and flexible.
What do the wires do?
What's
the purpose?
The purpose of the wires to guide the teeth and bring them into their correct position. So initially, putting the braces on in their correct positioning is one of the most important things besides treatment planning a case, an orthodontic case.
How does the wire actually act as a guide to putting the teeth back into place? It's an interesting concept.
Yes, the guide is not the wires themselves. The guides are the brackets.
The brackets guide, not the wires.
Exactly.
The wires hold the brackets together?
Yes.
Okay.
So we put the brackets in their correct position, the position that I want to end up the treatment with, and I do use initially, of course, very thin and flexible wires.
Right.
The wires initially would be kind of roller coaster up and down, and over a period of time, once we change the wires into thicker and stiffer wires, then those will guide the teeth and make them all straight.
Yeah, I want to roll some more videotape of your staff at the West Shaw office working on some patients here, and they're looking at x-rays on the computer and then working on the patient at the same time. And so putting those brackets on, putting the wires on, there's really no pain involved is what you're saying, and that's
Correct.
why you don't have to use the needles.
Correct, yes.
Is that right?
Correct.
Okay. And so you use all the typical traditional dentistry instruments, right? That any of your general practitioners would use. Is that correct?
That's correct, yes. And all sterilized or clean. And as you've seen on the video, we protect the eyes of the patients for any emergencies or...
what is she doing there?
What she's doing there is she's putting ligature ties on the brackets to hold the teeth in their position. And that's...
now, generally speaking, if you go in and have braces put on, do these braces have to stay on for any length of time?
Of course. They, on average, it would take approximately 18 to 24 months for the whole treatment from start to finish.
Wow.
And
You're talking almost 2 years.
Yeah, a year and a half to 2 years.
Yeah.
On average. And it takes approximately an hour and a half to 2 hours to do the first procedure, taking x-rays, records, and putting the braces on. So it's not that much of a time that putting actual braces on.
And how much do you see the patient during the process? Does the patient comes in periodically for checkups?
Definitely. They would come once every 4 weeks or 6 weeks.
Okay.
Yes.
All right. What are the biggest problems that you see with kids?
Of course, I'm sure you want to hear this, but brushing and flossing, which we're on top of them, and we check them each and every visit if they're brushing correctly or not, and guide them and show them,
What causes teeth to go crooked? What causes an over? Is it just you're born that way? Is it with birth?
Pretty much, yes. That's the way it is, and most of the cases.
So you're trying to correct nature, basically.
Well,
in a way,
yes. Same thing as having a cavity. We're correcting nature as why we have cavities. Even sometimes people that they brush and floss and keep their teeth clean, still they have cavities, and we have to correct it. We're correcting nature, correct?
Right.
So it's same thing.
What
as
kind of problems with the kids do you see besides brushing and having cavities and all that kind of thing? But when they come in and you evaluate them, what kind of problems are they having? More overbites, underbites, or does it vary?
It varies. Most of the time, I do see crowding and overbites. Rarely I see underbites or missing teeth and so forth, but they're all correctable. And I tell the patients that it takes approximately very close to have the teeth, and they tell the parents also what issues we have and to correct it.
All right, another call here. Good morning. You're on Connect with Me. How are you?
John, good morning.
Good morning. Speak up.
Can I ask doctor one question?
Sure.
1 or 2 questions.
You can ask as many as you want. Go ahead.
Okay. Doctor.
Yes.
What does it take to? I'm not sure, but I heard maybe too much polishing of your teeth ruins your enamel. Can you correct me on that? Tell me.
Sorry, speak up. Say
polishing your teeth, does that hurt your enamel?
It doesn't. It doesn't. Why? Because after we remove the braces, to start with, when putting the braces on teeth, we do use certain type of cement to hold the braces or the brackets on the teeth, and this cement they're not very strong. The reason that we don't put very strong cement is when we're done with the treatment, to remove them. And sometimes we do get emergencies as broken brackets and so forth. Why? Because patients, they don't follow the oral hygiene instructions. So to answer your question as far as the enamel, no, we do use special type of tools or burrs to remove the cement, and they wouldn't hurt the enamel.
Yeah. Okay. You got time for one other question. What is it? Or is that it?
That's it.
Okay. Appreciate your phone call. This is a question that my daughter had, because I told her that I was going to have a dentist on, an orthodontist on today. She says, well, I can't get braces because some of my teeth are still falling out.
Yes.
Okay. Is that a problem when you put braces on a child that's 4, 5, 6, 7 years old, and they're still, their original teeth are still falling out? Is that a problem?
Well, as I mentioned earlier, that I do recommend, not only myself, it's recommended by the American Association of Orthodontists, is to have kids checked as early as age 7. So at that age,
what do you do when you put braces on a child and then bottom tooth wants to fall out? And what happens then?
Well, I wouldn't put braces on baby teeth.
Okay.
During the treatment, I don't put braces on
Not
baby
on
teeth.
baby teeth.
Not on baby teeth.
They have to have their normal
on permanent teeth.
Permanent teeth.
That's right. That's right. So that we can allow the baby teeth to fall out and then permanent teeth come into their correct position.
Okay. So that's pretty much the prerequisite for putting braces on. No baby teeth at all.
No baby teeth. In certain cases, rarely I do that, but along with putting braces on permanent teeth, we do use certain appliances to correct the growth and redirect it as much as possible.
Okay, 30 seconds. Can you give a phone number and a website as to how people can get a hold of you?
You can get a hold of us. It's very easy. Phone number is 222-2522.
Say that one more time.
222-2522.
Okay.
That's our Fresno office number. And the easiest way would be our website, uniqueortho.com.
Okay, doctor, thank you so much.
You're welcome. Thank you.
I appreciate your
Anytime,
time, and I
yes.
know how busy you are with patients,
Yes,
and it's
sure.
nice of you to come in.
Okay.
All right, that's
You're
our
welcome.
guest for today, Dr. John Bayrakdarian. He has 2 offices, one in Fresno, one in Clovis. Tomorrow, a very special guest. She's a single mom. What does it take to be a single parent and raise kids? Well, we'll talk about it tomorrow. See you then.
Watch me on Me TV, on Mary Tyler Moore.